I did cover that in the previous session, but let me summarize. So the primary reason for being in Asia for us is demand. So we got tremendous interest from presenting at conferences in 2018 and early 2019 from insurers of different and substantial sizes in asking us to come in and talk about benefit use cases, clinical use cases, and financial use cases. And in our world, there are three primary types of care networks: benefit coordination network, clinical care and care coordination networks, and financial and payment and benefit payment coordination networks. So whether we are doing benefit coordination or care coordination or payment coordination, payers are very interested in one, two, or all three of these scenarios. And why we spend the time in Asia is discussing with various payers in various different countries which of these type of networks, and within the network, which type of cards they would find most compelling. And we're very keen about pursuing this market. We have made a clear expansion plan, now targeting Asia as a growth strategy for us. And as I mentioned in the previous conversation, we are about 18 months ahead of schedule. What we are doing today, we had always planned to do, except we were going to do it next year. And we're doing it much, much sooner because there is demand. And when the customer calls and says, hey, I look at Solve.Care platform and I think I have a direct use case that I want you to bring to my membership, we obviously will respond to that need. But when that demand comes from multiple corners of a region, then it becomes a strategy. Then we have to pursue it. So we're very excited about the opportunity there. The second reason I spend time in Asia is looking at capital markets and looking at, is Asia a good place for us to call home from a capital perspective? In other words, is that where we want to list the company from a public perspective when 2 years, 3 years down the road, we are ready to be a public organization, an IPO? And things take time and you must plan them in advance. So, like everything else we do, we are making a plan on how and when we want to list the company from a public perspective. Of course, there are no guarantees, there are no commitments because the world changes around us and you have to adapt to it. But let's stay the course and let's continue to execute a plan. And that plan calls for either a meaningful participation from capital markets in Asia or listing in Asia. So we will start exploring all those options now with an expectation that next year we'll make decisions and the following year we'll execute. So that's the reason to be in Asia, but that's really not the primary driver. The primary driver is adoption and demand and applicability of our platform. And if you look at it in terms of a nutshell, Asia is where there is huge, significant population with very well-defined needs in terms of care needs, in terms of care access needs, in terms of self-pay needs. So all three networks, benefit, clinical care, and financial networks, have identifiable value to the Asian market. So when you have that much of a match between demand and supply, need and ability, and interest in our willingness, then it makes a lot of sense. Having said all that, we're not going to go into Asia, which is in itself a very culturally nuanced market. Asia is not homogeneous. The way business is done in China is different than the way it's done in Japan, is done different in Hong Kong, or is done differently in Thailand. So we're not going into Asia as some kind of a one blanket strategy. We are looking at a further granular strategy as to where do we have good partnerships that we can or have forged? Where do we have the right kind of payer, the right kind of patient demographics, right kind of membership, right kind of benefit plans, so we can orient the right benefit network or the right care network or the right financial network to that market. And we don't have to sell all three network types in any market to be successful. We only have to sell one. But we are seeing in Asia more than one. Most every meeting I've had, the client has asked for either a benefit and a payment network or a care coordination and a payment network or benefit and care network. But the point is the demand is cross-sectional, not just a single use case. And that's the power of our platform, right? That's the whole point, that we can address benefit, care, and financial capability and needs of our clients. And we're not a single-use app that does one thing. We're not a single-purpose patient provider appointment app or a member symptom management app which does a specific purpose and hopes for adoption. We are a platform on which you can coordinate benefits, coordinate care, and coordinate payments. You tell me the use case you need addressed, be it pre-authorization or eligibility determination or referral or chronic disease management, or you want to address a real-time adjudication of claims, or you want to have a real-time discharge payment from a facility. You tell me the use case, we'll give you the right care card. So we can address a lot of use cases. And if there is a willingness on the side of the client to explore those use cases, we are always going to be there to discuss it with them. And that's how the Asia strategy has evolved.